Experts are warning about a looming mental health crisis in the United States, resulting from the national lockdown and fears pertaining to the pandemic. But those concerns are widening with the added pressure of social injustice, and doctors are seeing more and more Black Americans, already a community that experiences health disparities, reporting anxiety and depression at higher levels. Dr. Olu Ajilore joins me now, and he's an associate professor in the Department of Psychiatry at the University of Illinois at Chicago. He's also a researcher at UIC Center on Depression and Resilience. Dr. Ajilore, first off, I want to ask about your experiences as a psychiatrist. You've been seeing patients virtually. I'm wondering how COVID-19, this pandemic, is affecting your day-to-day for all of your patients, and in particular, the lives of your Black patients.
Yeah, it's been really difficult because of the issues related to quarantine and social isolation. And that's contributed to rates of depression, anxiety, emotional distress. In addition, the protests around the killing of George Floyd have compounded those issues, especially as some of my patients have expressed concerns or fear about participating in these protests and possibly getting hurt in the protests or even catching COVID-19. And so all of these issues have contributed greatly to increasing rates of depression and anxiety that we've seen.
Well, we understand, especially given the pandemic, that the Black community faces health disparities that are further compounded by COVID-19. But that was the case even before the pandemic hit. Can you tell us a little bit more about, in your field, in mental health, what some of those disparities are and what it looks like?
Yeah, so one of the biggest issues are barriers to care. So barriers to access of care, barriers to quality of care. One of the issues that has been particularly of concern in the Black community is stigma. Fortunately, that's been reduced over time with normalization of getting mental health treatment. And this normalization has occurred because of images in the media, on TV shows, and in popular music, where people feel more comfortable expressing their struggles with mental health treatment, and they're more open in showing how people have gotten treatment. But there are issues in terms of cost of care, having insurance, and also the number of practitioners who come from the same backgrounds of these patients. So we have less Black psychiatrists, less Black therapists, and an increased need for care for these types of clinicians. And so that's another big issue.
And I'm sure that that comes into even sharper contrast as a nation we are grappling with unrest over social injustice and police brutality, systemic racism. I imagine that also has caused patients to want to talk to somebody that can better relate to their own life experiences. So how is that impacting this dialogue about mental health in the Black community? And how do you address those shortages if people do want to see a Black mental health care provider who they feel like could better relate to the problems that they're experiencing?
Yeah, and this is one area where technology has been really helpful in a couple ways. One is that we've had relaxed restrictions on telemedicine. So we've had access to teletherapy, telepsychiatry. So that no longer restricts your available pool of clinicians to where you live, but you have access to clinicians more widespread. The other thing is that there's been an increasing attention on social media, online, Instagram, Facebook, where people have collated resources for Black people seeking mental health treatment. So there are websites, there are groups like Therapy for Black Men that collate groups of clinicians of color or people who are trained in cultural competence to treat these issues.
That's very interesting. You don't hear many good things that come out of the pandemic, but perhaps the move to telemedicine, particularly in this field, is one very small ray of light. But what more needs to be done to improve mental health and make treatment more accessible for all Americans, and in particular, Black Americans?
Yeah, I think, first of all, we need more clinicians of color. We need more Black and brown medical students going into mental health, going into psychiatry. That's something that we're working on at the University of Illinois College of Medicine. I think improving that pipeline of getting more clinicians out there will be really important. The other thing, as I mentioned, the technology, I think that will help reduce the barriers to care, as well as reduce stigma so that Black people feel more comfortable seeking out this care when they need it.
Well, a very good point, and certainly there should not be any Feelings like you can't talk to somebody, given all that is going on right now, it is a difficult time, and helping to remove that stigma is so important. Dr. Olu Ajilore, thank you for joining us.
Thank you for having me.